Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Have you ever heard about fatty liver? One of the leading causes of liver failure in the United States. It is believed that in the United States, there are 100 million people with fatty liver. Do you have fatty liver? Or do you know someone with fatty liver? I'm Dr. Cooper Dockery, and welcome to Get Healthy. Get Healthy is a program designed to educate you, the viewers, on how to live a healthy lifestyle using lifestyle modification and thus prevent chronic diseases, reverse chronic diseases, or even cure chronic diseases. So I'd like you to sit back and relax as you listen to this disease that you probably have, fatty liver. I have on my show today Mr. Jose Matrier. Jose Matrier is an RN, but he has dedicated most of his life teaching and empowering people to use lifestyle modification to prevent and reverse chronic diseases. Jose, welcome to the show, Get Healthy with Dr. Cooper.
Hello, Dr. Cooper.
It's a pleasure having you, Jose.
Oh, thank you. I'm
Jose,
very happy to be here.
Very good. Tell us a little bit about yourself. Tell the viewers a little bit about yourself.
Okay. Like you said, Dr. Cooper, I'm a registered nurse, and I currently work as a certified wellness coach. And like you said, I help people change their lifestyle so they can live happier and healthier lives.
Very good. So we have a very, very vital topic today, and that is fatty liver. You know, in my practice, I see a lot of patients with fatty liver. Have you ever coached anyone with fatty liver?
Well, when I was going to RN school, I did about 7 months in a mental health institution, and there were several people there with fatty liver, and we'll probably get into it a little bit because we're going to talk about nutrition, which is really one of the main causes of it. But there's something else that I would like to talk to you about today, and that's about emotions and how emotions affect the fatty liver.
That's interesting, and I'm sure a lot of our viewers would like to hear about emotion and fatty liver.
Yes, absolutely. So if they stay tuned, I'm sure they'll be in for a surprise.
Right. You know, right now, the leading cause for liver transplant is hepatitis C. But statistics show that there's so many patients having fatty liver nowadays that in 2020, then fatty liver will be the #1 cause for cirrhosis and then liver transplant.
Yes, absolutely. As a matter of fact, right now it's starting to overshadow alcoholic fatty liver.
Imagine that.
So it's very interesting because we've known fatty liver to be just related to alcoholism, but now people that don't consume a drop of alcohol now have this disease.
Right. So
and
now,
that's what we're going to focus on today.
That's right.
Non-alcoholic fatty liver.
Right. Non-alcoholic steatohepatitis or non-alcoholic fatty liver disease.
There you go.
So here we have the body and we have all the organs. Where exactly is the liver?
Well, the liver, you're going to find it on the upper right-hand
side
quadrant, and
so
it's actually right behind
the rib cage.
The rib cage, exactly.
Right. So here I'm removing the liver right here. So this is the stomach and the liver sits right here. Now the liver here has 2 lobes, right? So on the right side we have the larger lobe and then we have the smaller lobe. And right behind here, we have the gallbladder because the liver produces bile that gets stored in the gallbladder, and this assists in the digestion of fat. So, what are the other functions of the liver?
The liver is like a mini factory. It has many functions, but I'd like to mention a couple of them. One of the functions that's very important for the liver is that it filters your blood. It
That's
filters
right.
everything that we eat has to be processed through the liver.
That's right. So
And it also another function is also to produce cholesterol, and there are just so many other functions, and also it helps produce protein.
that's right.
Okay?
So protein that we need to improve our immune system and to prevent infection, some of them are produced right in the liver, correct?
That's right. That is
The
correct.
liver digests fat. So the liver has some function. We have the exocrine, that's the production of hormones and so forth. And then we have the exocrine that has to do with digestion of the fat.
Okay,
Right.
that's another important thing is digestion, and also that's one of the reasons why your emotions when you're angry, or when you're frustrated, okay, or when you're being unforgiven, one of the first things you notice is that you lose your appetite or you have a bad digestion. Okay, it's cause of your emotion, which affects the liver. And then, as we know, the liver is the one who produces the bile,
That's right.
okay, which is stored in the gallbladder,
Gallbladder.
okay, and then helps with the digestion, especially fatty foods, right, or grease,
Right.
grease. And but when you are emotionally unstable, you're going to affect
The liver.
the liver.
We're Foodamed, a great restaurant with a healthy style, serving the best food and 100% vegan. Each dish with an exquisite and unique flavor. Bring the family, enjoy, and eat healthy. The best in food prepared by our chef and highly qualified staff. We're available. Consider us for your next event. All in one convenient location. Foodamed. All our food is plant-based with a variety of dishes. A wonderful variety and delicious. Yes, food is medicine. Foodamed. 6401 North 10th, McAllen, 956-731-4484. Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today.
So here we have a normal liver, smooth, we can see that there. And then here we have this one. This is obviously fatty liver. So the difference is that, actually, what is fatty liver?
Okay, fatty liver is when 5 to 10% of it is composed of fat.
Right.
Then you are considered to have
Fatty liver.
fatty liver.
So usually a patient might be asking, are there symptoms?
That's right. In the beginning stages, there are no symptoms.
That's right.
So many people right now may be suffering of fatty liver
And they don't know it.
Don't even know it.
Right. So how do we usually diagnose fatty liver if there are no symptoms?
Well, basically, you would go to, and most of the time you find it by going to the doctor for just a normal physical or something else, and then they may run a blood test and see that your liver enzymes are a little on the high side.
Right.
Okay, so that may prompt them then to send you for
The sonogram or CT
exactly,
scan or MRI. So usually it's just an abnormal blood test. And
exactly.
then with the sonogram, we can see enlarged liver and we see that might indicate fat. And we usually don't necessarily do a biopsy. So there are no usual signs and symptoms initially.
Initially, now as it starts progressing, then the person might feel weakness, might feel nausea, actually might have swelling of the legs,
Okay.
Abdominal swelling.
That's when it's now
Okay.
gone into liver cirrhosis. Here we have the stages. This is the healthy liver, nice and smooth brown, and we can see the changes here with the fatty deposit in the liver. And then from this stage, we have scarring. So scarring affecting the liver. Here we have cirrhosis. And you know that from here, then, the symptoms that you just mentioned, the swelling, the enlarged abdominal gird, right? Redness of the palm, yellowness of the eye.
Yes.
Patient might become a little lightheaded, confused, and so forth. And liver cirrhosis can also lead to liver cancer. So a benign problem like fatty liver can lead over here to liver cancer.
First of all, it starts mainly because of our way of eating, our lifestyle. That's the main thing. And since it was caused by our lifestyle, our way of eating, then we would need to
use
just
food.
Simply,
use food as medicine.
Exactly. Use food as medicine.
Hi, I'm Dr. Cooper Dockery. Did you know that prevention of diseases is the gold standard to keeping you healthy? But early detection is also vital. So why don't you call your doctor today for an evaluation? You know, I have Adrienne on the road trying to get some questions from the people that he meets, because I'm sure that a lot of people do not know about fatty liver. So I want to bring Adrienne in right now to see what questions he has for us. All right.
Dr. Cooper, I'm here with Diana, and she has some questions for you.
Yes, Dr. Cooper. I would love to know what are the symptoms of fatty liver?
So Diana wants to know the symptoms, and we just mentioned that. Initially, no symptoms at all. The patient will feel healthy, patient will go to the doctor, maybe for a routine exam, and then the doctor will probably find what we call abnormal liver enzyme study. And from there, the doctor will order sonogram, or if needs be, CT scan, but usually with a sonogram, that's enough.
Would be suffice.
Exactly. So initially no symptoms, but as you said, as the disease progresses and become now hepatitis or cirrhosis, then the patient can have more significant symptoms like yellowing of the eye, white stool, dark urine, redness of the palm, drowsiness, and fatigue and tiredness.
Dr. Cooper, I'm here with Mike Sanchez. He has a very interesting question for you.
Yes, I'd like to know how I could prevent this disease.
All right. All right, I'm going to give that question to Jose.
Okay.
How can you prevent this disease?
Yeah, good question. Good question. As we said earlier, it's a lifestyle disease. So you started it, you initiated it with the wrong lifestyle, let's say, and sometimes not even knowing it. So you can just reverse it with just some changes in your lifestyle. And that starts with our nutrition, because one of the main functions that we said of the liver is processing everything that goes through
in the mouth. But let's talk specifically about food that can lead to fatty liver.
Okay.
All right?
Yeah. Well, sometimes we think that you have to really have a terrible diet, but not necessarily. Not necessarily. As if you're just the type of person that does not like, for one reason or another, to consume whole foods, you know.
But what are whole
Whole
foods?
foods are those that come from nature, that come from trees, that come from the ground.
Unprocessed, unprocessed.
That's right, unprocessed, as unprocessed as possible. That's what you want.
Also, Jose,
Yes.
a diet high in fats, animal products, fried foods,
That's-
red meats,
Yes.
a diet high in high fructose corn syrup,
Yes.
a diet high in sugars, all that can lead to obesity.
Absolutely,
Okay?
absolutely. Who's at risk? I mean, if you're a type 2 diabetic, you're very high risk. If you consume like you just heard the doctor say, if you consume fried foods on a very regular basis, okay, you're a very high risk for fatty liver disease.
Right.
And
If you're obese,
if you're obese,
That's it.
that's like 95% high risk level.
right, so obesity, type
Yes.
2 diabetes, high cholesterol, high
High
triglycerides,
that's right.
all that can increase the risk for fatty liver disease. So how do you prevent it? If you're overweight, just losing 7 to 10% of your body weight will significantly decrease your risk or even improve the disease.
Yes,
Okay?
absolutely.
If you lower your cholesterol, for example, if you start to consume foods that we have right in front of us here, so we have a lot of fruits and vegetables. These are just fantastic because we have no cholesterol here. These are low carb, so you're not going to gain weight from here. So consuming all these here will lower the risk for fatty liver disease.
Yes, and another thing, Dr. Cooper, also you want to go into high sulfur foods, which are like you have garlic.
Yes.
Okay, and if you have cruciferous,
Right.
as far as
That's broccoli, cauliflower, kale.
yes, exactly. What it is with high sulfur foods, even though they say eggs are high in sulfur, but I tend not to go in too much into animal products because the way they are treated today is not the same
Not the
as
same as-
before.
right.
But if you stick with those with the high sulfur foods, basically it raises your glutathione levels.
Right,
Okay.
right.
And then that glutathione is an antioxidant which will help reverse your fatty liver much quicker.
That's right. And you mentioned garlic, onion,
Onions?
turmeric.
Oh yes, absolutely.
Because those are anti-inflammatory food.
That is
And
correct.
here at the Wellness Center, we have the turmeric sunrise. This is an anti-inflammatory, and this is going to help to protect the liver cells and then help to prevent.
Absolutely, Dr. Cooper.
And on this side, we have a lot of nuts and seeds and legumes, high in protein, high in fiber, but not high in cholesterol. So this can protect the liver.
Dr. Cooper, I'm here with
George Galindo,
and he has a really interesting question.
how do you treat a fatty liver?
All right, so treatment of fatty liver. First, we want to prevent the fatty liver.
Right.
But how do we treat it? By changing lifestyle. Eating healthily, reducing the fat, the fried foods, the processed food, lots of plants, and decreasing the intake of animal products. And if you're overweight, then lose weight.
That is correct. Also, another thing, read the labels. You want to stay away from GMOs, genetically modified organisms. You want to stay away from MSG, monosodium glutamate. Okay, and
trans fat
fats
and high fructose corn syrup.
Anything that says hydrogenated or partially hydrogenated, okay, you want to stay away from that. The thing is, we're consuming them on a regular basis and don't even know that we're consuming it.
The last question was very, very interesting. How do we treat fatty liver? Currently, the medical community is trying right now to find a cure, to find pills. But we know that lifestyle Lifestyle modification, that's the treatment for fatty liver.
That is correct.
So as you are watching us today, remember fatty liver is a lifestyle disease. Fatty liver can lead to hepatitis, can lead to liver cirrhosis, can lead to liver failure, the need for transplant, as well as carcinoma. So as we discussed today, the treatment, the prevention is the same. Change your lifestyle, eat differently, and you will prevent fatty liver. Jose, any last minute words from you?
Basically, that's it. Lifestyle is what caused it in the beginning, and lifestyle is your answer to the cure.
That's right. Jose, thank you so much for joining us.
Welcome.
And I hope to invite you back in our next show.
Thank you.
Don't go away. We'll be right back with more on fatty liver. Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
Welcome back to Get Healthy with Dr. Cooper. As you know, the aim of this show is to educate you on how to use natural remedies for good health: exercise, nutrition, stress management, water, and the sun. Today we are in our Living Active segment, and we have something very special for you. Ramsey, welcome. Tell us what you have for us.
Thank you, Dr. Cooper. Thank you for having me. What we're going to have is aquatic exercise. This benefits elderly, this benefits the obese population, also diabetics, and also a good way to start into exercise. If you haven't been active lately, it's a great step to get going, get everything going. So what we're going to start with is an A skip. We're going to come here straight forward, nice and simple. This is a simple demonstration. This is the advanced demonstration right here. So the advanced demonstration is just going to have that knee come up a lot faster and thrust it way up. Boom. Boom. Each time they're going to be coming down and back, down and back. Same thing. Boom. Nice and controlled, nice and controlled. There you go. And we notice how the advance is bringing that knee high, making that water splash. Don't be worried. It's just we're getting that work done. Now here we're focusing on the ligament activating, coming up and down, okay? So now we're going to do the B skip out. The B skip out is just going to pertain to you pretty much kind of like kicking the door down, nice and controlled. The basic portion is just going to do it as you can, nice and controlled, the way she kicks out. Focus on that knee driving up. Now in the advanced section, now she's going to do it with a little bit more arm movement and a little bit more oomph behind the kick. Now she's really kicking the door down. Bam, bam, there you go. Getting it done, getting it done. There you go, there you go. Good job. Notice how the advance is really thrusting that knee up, thrusting that knee high. Good job, good job, good job. Now what we're gonna get into is the high knees slow and high knees fast. Here in this segment, I want the basic just to go nice and controlled. Now pick it up a little bit faster, a little bit faster, 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 pick it up. Do as much as you can. Now the advanced section, we're gonna distinguish the big difference on the speed. Slow and fast. Let's go, let's go. Nice and slow, nice and controlled, nice and controlled. All right, now pick it up, boom, 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 slow. Nice, 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 fast. Pick it up, boom, 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 boom. Now she's gonna bring it back the same way, doing the same thing. Let's go. Bring it back, boom. Fast, 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 slow. There you go. Fast, 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 fast. Finish it, finish it. Slow. Good job. Good job. Hey, they are working. Don't believe it. Believe it or not, they are working. All right, so now we're gonna go into the side step, right? The side step, the basic, we just want you to go just walking sideways, involve the core, start working that side leg muscle, and just nice and controlled. Open yourself up. Don't be making small steps, make big steps, big wide steps. Over here in the advanced portion, we're gonna stay low. We're gonna stay low and open up, boom, open up. There you go, stay low, stay low, stay low. Now you notice how the basic is just coming nice and smooth, good job. Perfect, perfect, perfect. Stay low, stay low, stay low, stay low, stay low, stay low. There you go, there you go. Come on in, Dr. Cooper. I hope you like this segment.
Wow, Randy, I just love this segment. Now you out there, if you're elderly, if you're overweight, you're disabled, this is your exercise for you. Randy, thank you so much, and we'll see you again soon. Hi, meet Sarah, a normal girl like you. But Sarah had a big problem. Sarah was overweight and thus increased her risk of dying young. But luckily for Sarah, she discovered Dr. Cooper's complete weight loss solution, and now the problem is gone. In this solution, there's a set of DVDs, 40 cooking videos, exercise DVDs with exercise band, Dr. Cooper's book 14 Days to Amazing Health with over 100 delicious recipes and helpful tips. What are you listening to me for? Listen to what they have to say.
I was able to lose 20 pounds, I didn't want to, which helped me to drop my high blood pressure medication. My mother lost 50 pounds and no longer takes diabetic medicine through the program.
And I've learned a lot. I've learned that I can prevent any disease by having a healthy lifestyle. I lost 8 pounds, yes.
I came to Dr. Cooper. I had diabetes. Within maybe 2 months, I was doing better. I'm off my medication. I continue to do exercise and follow a diet. Follow Dr. Cooper's directions and everything will be okay.
For only $79, we'll send this complete kit to you. Go to my website, drdonnacooper.com, or call 1-844-343-8935. Hi everybody, welcome to my kitchen. Now today in the show we were discussing colon cancer. And you know you can actually use food as medicine. So I have a very simple recipe for you. This is hummus. Have you ever heard about hummus? Hummus is made from chickpea. Chickpea is high in fiber, high in protein, good fats I'm going to be using as well. You can follow me on the screen, so let's start. So I'm going to be using 2 cups of chickpea already cooked and drained. I'm going to put it right here in my food processor. All right, so this is my chickpea. Then I'm going to be adding my onions. Now, I like to use the onions somewhat roasted. So if you like onion, you can put a lot of onion. The onions are there. Then 2 cloves of garlic, chopped. All right, and that I am now going to add my tahini. Now, tahini is made from sesame seed. It's similar to peanut butter. This has good fat, the omega-3 fatty acids. So if you don't want to get heart disease or even colon cancer, this is good fat you can use. Now, if you're talking about Mediterranean dish, it's never complete without your lemon. So I'm using lemon juice, about 1/3 a cup or 1 large lemon. Then to that I'm going to be adding a cup of water. All right, so I'm adding my water there. Then I'm adding some cumin. All right, so this is the cumin. And then I'm going to be adding a pinch of salt. Now remember, too much salt is not good, and we're using sea salt. Sea salt has more minerals. Then further, I'm doing roasted pepper. Alrighty, very simple dish. I'm going to blend all of that together. I'm going to process this. So let's see what happens here. All right, so we're going to process this. Now you can check the consistency to see if it's too soft, if it's too hard. If it's too hard, you can add some more water. So I'm checking here. This is very good for me. Looks very delicious. All right. Now, how do you consume hummus? I have the final dish already prepared right here for you. So this can be used as a dip. It's actually a dip. You could use your pita chip. You could use vegetables. Remember that if you really want to prevent colon cancer or any disease, chronic diseases, lots of vegetables. So don't hesitate to use your green vegetables and just enjoy as a dip. Let me try this that I prepared earlier. Delicious. So if you want more recipe, go to my website, drdonnacooper.com.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935. We're Foodamed, a great restaurant with a healthy style, serving the best food and 100% vegan. Each dish with an exquisite and unique flavor. Bring the family, enjoy, and eat healthy. The best in food prepared by our chef and highly qualified staff. We're available. Consider us for your next event. All in one convenient location. Foodamed. All our food is plant-based with a variety of dishes. A wonderful variety and
How to live a healthier lifestyle using healthy nutrition. But sometimes we think healthy is only fruits and vegetables, nuts and seeds. But actually you can have a healthy dessert. And so many times those people who are whole grain, who tend to eat healthily, cannot find a healthy cake. So on the show today, I will be making a vegan cake. I'm going to give you a basic recipe that you can tweak at home using different fruits and spices. So we're doing vegan cake, and it's going to be a fruit cake with lemon. So we're going to start first of all with the sugar. So what type of sugar I'm going to be using? I want you to use cane sugar. It's less processed, it's less sweet, so if you're diabetic, your sugar will not rise that rapidly. So I'm going to put the sugar in. Let's go. So it's going to be 1 cup of sugar. This is half a cup, and this is another half a cup, and use cane sugar. Now for the milk, I won't be using any oil because I want to make sure the cake is as healthy as possible. So I'm going to be using coconut milk, and using 1 tin of coconut milk. So let's get the milk out. You know, I like to make this cake for the restaurant, the Foodamed vegan restaurant. We do different types of healthy cake, and this is one of this. So if you're oilless, if you're a whole food, plant-based person, but you don't use oil, then listen up, because this is a great recipe you can do at home. Now I am going to be adding my fruit. This is actually apple, and I have grated my apple. This is it. So I use an apple about a moderate size, and I have grated the apple right here. So I have this left over. So the apple is going to be added. And the apple is good to help the cake to rise. So it's going to be half a cup of a grated apple. I'm not using applesauce, but actually grated apple. So it's there, half a cup. And then I am going to be adding my lemon juice. The lemon juice is fantastic, so the cake will rise. I'm using about 1/3 of a cup of lemon juice, fresh lemon juice. So I have it here. And then I zested this lemon here. So if you have a zester, you can just zest it just like this. If you don't, just use a grater and just grate it and get the zest off. Just add it in, all right? So this is my zest, a whole lemon that is zested. It's right here. It's going to give the flavor. Get some vitamin C because you have the the lemon juice right there. From there, I'm going to be adding various fruits. So I'm using raisin. So the raisins here, I'm using half a cup, and these are the small raisin or currants. And of course, you could add any fruit. So I'm adding right now my cherries that are chopped. Now, I also like to use vegetables in my cake. Remember that this is an emphasis on eating healthy. So here I have, what is this? This is beet. I'm going to put some beet to this. You know, I also put green leafy vegetables in my cake. That is fantastic. So I'm going to put some beet in the cake. All right? So you can put half a cup of grated beet. All right? So let me put some right here. And remember, you can put any vegetables or any fruits. All right. So it's about half a cup of beet, grated. I'm going to mix this around some. Make sure the sugar gets melted out. This is really delicious. Just try this at home, and I mean, it is fantastic. Now I'm going to add my flour. I am using 1 cup of regular flour and another cup of whole wheat flour. So if you can see here, it's really brown. All right, because we're going healthy. We need fiber in everything we consume to prevent diseases. This is going to be amazing. Now, I'm going to be using 4 teaspoons of baking powder, all right? And then 1.5 teaspoons of baking soda. Remember that we have no egg, no oil in here. And I am going to be using 1/2 teaspoon of salt. So here's the salt. To that, I'm adding some spices. I'm adding cinnamon, and I'm adding nutmeg. You can also use mixed spice. And I am missing my vanilla. Where's my vanilla? All right, so here it is. It's white vanilla. It's 1 teaspoon of vanilla. Alrighty. So we're going to mix this all together. Now, if you have a mixer, just use the mixer. If you want to be old-fashioned like myself, you're going to mix this all up. You're going to put it in your baking sheet, your baking tin, that you will have to grease. Or you could use a non-grease tin. And then you're going to bake that for 6 to 7 minutes of 350. This is good. And if you make it at home, send me a message. Let me know how it comes out. All right. So let's get everything out of here. You can have this with some delicious vegan ice cream. And by the way, you can find most of these recipes in my books. I didn't even mention that. So here we're ready to go. I'm going to put this in for 6 to 7 minutes, 350 degrees Fahrenheit. Let's see what happened. Now you have to preheat your oven. Now, here is the final product. Here we go. Fantastic and delicious. Very sorry you can't taste it, but after the show, the cameramen are going to be tasting it. This is really, really good. I want you to take a look at this fantastic looking cake. Here we go. So this has beet, it has orange, it has cherries and raisin. So for more recipe, go to my website, drdonnacooper.com. Hey, do you have high blood pressure, diabetes, hypertension, cancer? Well, come over to Cooper Wellness Center. We have raw organic juices filled with vitamins and antioxidants, good for any diseases. So come over to Cooper Wellness Center and ask for one of our juices, and we will serve you up something that will give you long, healthy life and help you to lose weight and get off your diabetes medication. Come to Cooper Wellness Center.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series, Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today.
Welcome back. You're in my kitchen today, and I have something very special for you. Now, my name is Dr. Cooper Dockery, and I like to emphasize plant-based whole food nutrition because we know that that can actually reduce your risk for chronic diseases. However, what can you eat that is sweet or unhealthy for you? So I have a guilt-free ice cream. Ice cream, I said, I am doing ice cream on the show today. I will be doing banana papaya ice cream. And for the recipe, you can find it in my cookbook, Incredibly Delicious Vegan. So what do you need for this recipe? Not much. You need a high-speed blender. You need some frozen banana, 4 cups of frozen banana cut in pieces, then 3 cups of ripe frozen papaya, 3 tablespoonfuls of non-dairy milk powder, and of course about 1/2 cup to 3/4 cup of nut milk. So let's begin. This is actually very delicious. So we're going to place our frozen fruits here in the blender, and sometimes there might be a little bit of difficulty getting everything blended, but just be patient. It is actually delicious. So we're putting a ripe banana, frozen, and these bananas should be very ripe. And then we're going to add our milk. And this time I'm using almond milk. So I'm going to add this, I'm going to blend that, and at the end I put the milk powder. So let's see what happened here. All right, let's see if this thing works. All right, we are going to start. Okay. All right, we're going to blend this. Okay, hold on. Okay, got it. Now you can stop and check. You might need to give it a little spin. So I'm going to get a spoon and we're going to spin this around. All right. And we need to continue to blend this until we get it the way we want it. So let me push this down and we're going to blend again. It's really delicious. You know, my kids love ice cream, and when I make this, they don't know what it is. All right. So let's blend this again. Very delicious. Okay. We're going to give it a little stir again, and sure, it sometimes might be a little difficult to get it done, But just be patient because this is healthy, no sugar, no egg, no saturated fat. This is healthy for you. I'm going to go ahead and add my, my milk powder because we're coming to the end of this. Okay, let's add the milk powder and get it all blended inside this ice cream. Very, very delicious, I promise you. All righty, let's see. I am going to check on it one more time. You give it some time. And you're going to enjoy this thing. Remember, it's in my cookbook, 14 Days to Amazing Health. All righty. This is our last blending. We're going to see what happened here. All right, so it is done. I'm going to serve the ice cream. Let's take this off, get back here in the middle. And this is actually fantastic. Let's try. You put a scoop in here. You can have this with some nice, delicious vegan cake. This is my final product. I'm going to be doing 2. All right, this is really good. So if you want to eat something healthy but sweet, guilt-free, no cholesterol, no sugar, this is the way to go. You can keep this in the refrigerator, harden it up somewhat, and you're ready to go. This is our vegan ice cream. Very, very delicious. So for more recipe, don't hesitate to go to my website, drdonnacooper.com. I'm going to taste this before I get off the air because I know this is fantastic. Try this at home. drdonnacooper.com, that's my website. Hi, meet Sarah, a normal girl like you. But Sarah had a big problem. Sarah was overweight and thus increased her risk of dying young. But luckily for Sarah, she discovered Dr. Cooper's complete weight loss solution, and now the problem is gone. In this solution, there's a set of DVDs, 40 cooking videos, exercise DVDs with exercise band, Dr. Cooper's book 14 Days to Amazing Health with over 100 delicious recipes and helpful tips. What are you listening to me for? Listen to what they have to say.
I was able to lose 20 pounds, I didn't want to, which helped me to drop my high blood pressure medication. My mother lost 50 pounds and no longer takes diabetic medicine through the program.
And I've learned a lot. I've learned that I can prevent any disease by having a healthy lifestyle. I lost 8 pounds, yes.
I came to Dr. Cooper. I had diabetes. Within maybe 2 months, I was doing better. I'm off my medication. I continue to do exercise and follow a diet. Follow Dr. Cooper's directions and everything will be okay.
For only $79, we'll send this complete kit to you. Go to my website, drdonnacooper.com, or call 1-844-343-8935.
We're Foodamed, a great restaurant with a healthy style. serving the best food and 100% vegan. Each dish with an exquisite and unique flavor. Bring the family, enjoy, and eat healthy. The best in food prepared by our chef and highly qualified staff. We're available. Consider us for your next event. All in one convenient location. Foodamed. All our food is plant-based with a variety of dishes. A wonderful variety and delicious. Yes, food is medicine. Foodamed, 6401 North 10th, McAllen, 956-731-4484.
Welcome back to Get Healthy with Dr. Cooper. Today you've learned a little bit more about fatty liver and realizing that fatty liver is a disease that is preventable. And if you have early stages of fatty liver, then you probably are time to improve or even cure your disease process. What do you have to do? You must first change the lifestyle. You need to change the way you eat, consuming less animal products, removing fatty foods, sugar, high fructose corn syrup, exercising, maintaining a healthier weight, and lots of green leafy vegetables, including garlic, turmeric, and onions. These are foods that will protect your liver from inflammation. And remember that if you're already in the late stage, whether it's liver cirrhosis or cancer of the liver, there is still hope. God, our Creator, will give us hope. He wants us to be healthy. In 3 John 2, he said that above all, I wish for you to prosper and be in good health. So don't be discouraged. Hope is on its way. So I would like you to follow us. Watch us same time, same station next week. And may God continue to bless you and your family. I'll see you again soon. Bye-bye.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website at drdonnacooper.com.